Hi, good evening, everybody. My name is Andrew. I'm your host for today's Saturday's Health Talk again. So, hi, Susan there. So, lovely evening to everybody to join us for this Health Talk today. So, before I go on for the talk proper today, maybe I just share with you on my left hand side. These are some of the social media links that you can source for more information and like the Facebook, IG, or Telegram by 365 Cancer Prevention Society as well as Farrer Park Hospital. Yep, there you go. So just to take note that all the information shared by today's event by the speakers and 365 CPS are for general information only and are subjected to changes. So remember to consult your doctors for any personalized or detailed medical advice. So next, let me share with you one of the campaign that we have that is ongoing. It's called My First Colonoscopy. So if you'd like to support us, there's two QR code that you can access to. So it's written here. So one is by give.asia. The other one is by give.sg. So let's say you strongly encourage you guys to support us through this My First Colonoscopy. And it's brought to you by 365 CPS, co-organizer by Icon Cancer Center, as well as SCRS, as well as StarMax. So what are we going to talk about today? Today is about what's new in prostate cancer, what are the prevention and diagnosis. Prostate cancer is actually the second most common cancer among Singapore men. So through today's talk, we're going to find out how it is being diagnosed, what are the usual telltale symptoms, the risk factors for developing prostate cancer, and what are some of the prevention strategies. So today's speaker is Dr. Lee. He's the consultant urologist and medical director from UroDoc. Let's welcome Dr. Lee.
Hi, Andrew.
Hi,
Good to
Dr.
see you
Lee.
again. Yeah.
Hey, so I leave the time to you.
Thank you so much. I'll go on to share my screen. Okay. Thank you, 365 Cancer 365 CPS, and for the kind invitation, as well as Farrer Park Hospital for nominating me. Thank you, everybody, for tuning in. The talk that I'm going to be sharing with you today is titled "What's New in Prostate Cancer Prevention and Diagnosis." Okay, this is my credential. My name is Dr. Lee Fang Jan. I'm a urologist by training, and the field that I practice is a brand of medicine called urology. Urology is a field of medicine that involves the treatment and evaluation of the urinary tract, consisting of the kidneys, the ureter, bladder, and the urethra, okay, which is present in both males and females. So we deal with cancer, so urinary tract, stones in the urinary tract, infection or urinary tract, or urinary problems, okay. But in addition, in the male, a urologist deals with the reproductive bit of the organ as well, okay, which consists of the testis, the prostate, which is the main concern of this talk, as well as the penis, right? So coming back to the talk, the outline, what I'm going to share with you is where is the prostate gland and what it does, common prostate condition, diagnosis of prostate cancer, and tips on prevention of prostate cancer. Okay, so who has a prostate? So we go back to basics, and this is a very, very basic question that I think everybody should know the answer to. Okay, men do. Okay, so prostate gland is only present in men, and any conditions with the prostate is generally a male health issue. What is a prostate? It is a male sex gland. Over here, okay, is the size of the walnut, located below the bladder and in front of the rectum. All right. The main function is the production of fluid that is present within the semen. Okay, So this actually, that's a very good illustration of the relationship of prostate with the urinary tract as well as the reproductive tract. Okay, again, this is where the prostate is. In terms of urination, what happens is that when you urinate, the urine actually have to flow through the prostate to come out through the penis. So any conditions with the prostate can impinge on the urinary tract and results in urinary symptoms. Okay. The second thing you can see here is the ejaculatory function. Semen actually flows through from the testis to the vas deferens and actually emit through the prostate and come out through the penis. Okay, so this is the place where, as it passes through the prostate, this is where it contributes to the fluid within the semen, the nourishment and food source that helps the sperm as they propel towards up the female genital tract to meet the egg. Okay, so as we age, okay, as men get older, okay, this is when the prostate start acting up and developing problems. And the first and most common condition that urologist sees as men get older is enlargement of the prostate. And it's most common in men above the age of 50. Okay, when the prostate enlarge, you can see that it actually presses on the urinary tract, causing symptoms of obstruction, slowing or urinary stream, for instance, or sensation that you have not completely emptied the bladder. Okay, again, this you can see as the prostate enlarges, okay, it causes a blockage and stops the urine from being able to expel through the penis easily, causing a bit of retention there. Okay, but that is not the focus of today's talk. Today's talk is regards to another common condition that affects the prostate, which is cancer. All right. And prostate cancer, how common is it in Singapore? Looking at the latest Singapore Cancer Registry data, okay, from 2014 to 2018, it has grown in terms of status to become the number 2 most common cancer in Singapore men. Okay, looking at all the statistics regards to the cancer in men, there's only 2 that is in double digit. One is colorectal cancer at 16.9%, and number 2 is prostate cancer. But taking into account the rest of urinary tract cancer, kidney, urinary organs, okay, the urinary tract actually is more higher propensity to developing cancer than colorectum, right? And you should know that, okay, because it's so prevalent throughout our lifetime, 1 in 8 men will develop prostate cancer. Okay, so which means that 1 in every 8 audience, okay, or viewers we have here, 1 of you potentially will develop prostate cancer in your lifetime. All right, that's how common it is. And prostate cancer goes through different stages as it progresses. All cancers start as a minute point, okay, as like T1 stage, and as it grows, become more and more, get bigger and bigger, and take some bigger proportion of the organ, and that's typically when you actually have symptoms. You can see that in the early stage when it's so small, unlikely for it to cause any big impact for you to actually have any symptoms in terms of affecting your urinary stream or your ability to ejaculate, or symptoms within ejaculation such as bleeding or pain, right? But as they are bigger, it actually presses on urinary stream, and that's when symptoms occur. Okay, at the late stage, it will have gone out of the prostate and affect the surrounding organ, invading the bladder, causing blood in the urine, for instance, invading the rectum, causing blood in the motion, or as it spreads to the bone, for instance, you get bone pain or leg swelling, right? Okay. So the symptoms of prostate cancer typically affects the urinary stream, such as weak or interrupted flow to the urine, or if it invades or irritates the bladder, you may have sudden urge to urinate or frequent urination. Okay. As the lumen get occluded, you may have trouble starting urination or problem emptying the bladder. Okay. And can cause pain on urination, blood in the urine or semen, and if it spreads to the bones, to the back, you can have pain in the back, the hips, and pelvis. Okay, it spread to the lungs, breathlessness, tiredness, dizziness, be anemia as well. But these are all very general symptoms, non-specific symptoms. Okay, even prostate enlargement, non-cancerous type, can give rise to some of these symptoms, right? Okay, so I reiterate, okay, early prostate cancer, when it's very, very small, actually has no symptoms, same as all the rest of the cancers, right? And what are risk factors, you ask, for prostate cancer? So these are the few known risk factors regards to prostate cancer. Age is one. Men tend to have a higher propensity to develop prostate cancer above the age of 50. Ethnicity plays a part. A man of African Caribbean descent or African descent has a higher propensity for developing prostate cancer compared to Caucasian or even Asian. Okay, if you have a family history, okay, some hereditary genetic mutation, okay, can result in a strong family history. If your father, your first degree relative, your father, your brother has prostate cancer at a young age, below age of 55, you may have inherited some of these genes and you have a higher tendency to develop prostate cancer as well. Okay, so common question then is, hey doc, I'm worried, okay, that I want to know whether I have a risk, whether I have prostate cancer. How do we diagnose it? So usually there are two things that we do in terms of diagnosis. One is a simple blood test called PSA blood test. Okay, PSA stands for prostate specific antigen. You're detecting the level of a certain protein within the prostate. Okay, and the second thing that the doctor will do is something called digital rectal examination. So the prostate gland is actually deep inside the pelvis. A lot of times you can't see it, it's not on the surface, but if you put a finger into the anus, into the rectum, across the wall of the rectum, we actually can feel the surface of the prostate. If the prostate there is potential for cancer and it is of a certain size, okay, we may be able to feel some nodularity or hardness on the surface of the prostate. That will give us some idea to raise some high level of suspicion for us to investigate further. All right. Other questions some of my patients do ask is that, hey, if I'm concerned that I want to check for prostate cancer, what is the right age for me to start considering that? So in general, we'll say for the general population, from the age of 50, you can consider having a discussion with your doctor whether you're suitable to start prostate cancer screening. Okay, if you have a strong family history of prostate cancer, okay, at least two family members with prostate cancer, okay, then your risk will be a little bit higher. Then maybe from the age of 45, you can consider a prostate cancer check, right? So why do we keep emphasizing about, detecting it early, even though you have no symptoms? Okay, what you can see in this chart is that, the importance of early detection. Why? Because if you detect it early, you catch cancer in early stage, okay, and if you start treatment for it, the chances of a complete cure is a lot higher than if you catch it at a late stage. So in stage 1, and stage 2, where it's confined to the prostate, if you are detected with prostate cancer, then okay, undergo treatment, the 5-year survival is actually very good, okay, in the high 90s, right? If you are unfortunately detected at a late stage, stage 4, whereby you have spread, stage 4 means it's spread outside the prostate to other parts of the body, okay, then, even with the best treatment, okay, the likelihood of you surviving 5 years dropped dramatically to about 38%, right? Okay, so one more thing, okay, in Singapore, okay, it's important, good for you to know, 1 in 4 men with prostate cancer, okay, have advanced disease when diagnosed. What it means is that despite the advancement in medicine and how advanced our society is, a lot of men for a lot of men, we're still diagnosing prostate cancer at quite a late stage. Okay, if only we detected it a little bit early, then there's a much better chance for us to do something for them and prolong their life, right? Okay, so back to a PSA blood test. Okay, doc, okay, if I want to do a check, okay, what can I anticipate, in terms of screening for prostate cancer? So we talk about PSA blood test. PSA stands for prostate specific antigen. So what it measures is a protein that is secreted by prostate cells. So anything wrong with the prostate, you secrete this antigen. So it's not specific for cancer. So conditions like inflammation, infection of the prostate, benign enlargement of prostate will secrete some of these additional proteins in the blood as well. But it is specific for prostate, but not specific for prostate cancer. All right. Okay. So what can you expect when you take a PSA blood test? A bit busy this slide. I'll break it down a little bit for you. Okay. So if you do a blood test for PSA, okay, what will happen is that 80% of the time, your blood PSA level will likely be normal, okay, not elevated. So when it's not elevated, so you will have very low risk of prostate cancer. There's no need for further testing, and the doctor may advise you to maybe consider redoing a test in about 3 to 5 years, right? But if you belong to the 20% of men whereby the test shows that the PSA is elevated, it's higher than the upper limit of normal. So typically there's a level of 4. Okay, in the back in a few years ago, a lot of doctors will recommend a prostate biopsy. Okay, all right, to further assess, all right, to see whether there's any element of cancer within the prostate. And what is this prostate biopsy? Okay, this is what it entails. Okay, a prostate biopsy is actually taking tissue from the prostate to send to the lab to look at the tissue to see whether there's any element of cancer cells within the prostate. Okay, that entails a little ultrasound probe that's inserted into the anus. The ultrasound probe has sends ultrasound waves into the prostate to actually visualize where the prostate is. Okay, this is the shape of prostate that will guide the needle, okay, to take tissue within the prostate. Usually, the ultrasound will not be able to tell us whether there's areas that is cancerous. So what we do is a template biopsy. We spread out the different cores of biopsy throughout the prostate to take tissue, so that that increases the chance of the coverage of the prostate gland, to increase the chance of picking up cancer if it is there. Okay, obviously, the more biopsies we take, the better the sampling, but you don't want to do excessive sampling, or else you end up with what you see in the picture, and of course it runs into greater risk of complications like bleeding, like swelling of the prostate, like infection, for instance. Okay, so having done a biopsy, you see that 25% of the time you will pick up cancer, right? And then for this patients, okay, we can institute treatment. Okay, and having done that, okay, if we've gone through all this step in terms of screening, you find that we have a 50% reduction in risk of prostate cancer spreading, because we're picking it up a little bit earlier, and also a 20% reduction in risk of death from prostate cancer, because we're picking up prostate cancer before it's at a stage whereby it's difficult to treat or cure, right? Okay, and if you do suffer side effects or complication from biopsy, but when you do pick up the prostate cancer, then the doctor or a treating physician may not feel so bad. But you do see that in 75% of the time, okay, that biopsy turns out to be negative, right? Okay, and we have a conundrum. A big bunch of patients is stuck within this group. Okay, why? Because when it's negative, the doctor can never be sure that, hey, it's not because of sampling, we're missing certain areas whereby there may be cancer. right? So what will end up is that the patients may end up getting regular PSA blood tests and even repeat biopsy, okay, year on year. So that impose a lot of unnecessary invasive procedure in a big group of patients. So that's the conundrum that we have with the existing or the previous way that we actually diagnose prostate cancer. All right. So what has changed? Okay. So with the advent and improvement in a lot of technologies that we have, as well as more of this technology, chief of which is the MRI scanners and a good protocol for a very detailed prostate scan that has been in place over the last few years, that has come in, and that we find that is actually a lot of patients are put through this now. So when the PSA is elevated, instead of going through a biopsy, we can actually send the patient for a detailed MRI. Okay, if the MRI shows that, hey, there's nothing suspicious within the prostate, this patient may be able to avoid the need for a biopsy. But if the MRI do show that there is an area that looks very abnormal, it looks very suspicious for a cancerous growth, then we can proceed on to do a biopsy for this patient. And this biopsy, we can target it at this particular area, okay, to focus on the area to see whether it's cancer, avoiding the need to do a widespread template biopsy unnecessary, putting the patient at risk for infection and complications like bleeding, for instance, right? Okay. So is there anything even better? So what is new and what is recently come on stream, okay, is even less invasive, is something called a MER Sentinel prostate cancer test, okay? And if I tell you there's a test, okay, that if done in terms of sensitivity of diagnosing whether it's cancer or not cancer to be as high as 94% and specificity of 92%, okay, you will be very happy, right? Why? Because with this test, with one of these tests, you can tell you whether yes, you have cancer or no, you don't have cancer. And if you do have cancer, it can even risk stratify you. Is this a low risk cancer, intermediate risk cancer, or high risk cancer to help the doctor decide what is the best treatment for you. All right. So this probably is a potential for a shift in the paradigm. All right. And if even tell you that this is just a urine test, okay, non-invasive, that's even better. So with this test, what you need to do is just collect a specimen of urine, okay, send it off within 7 to 14 days. It can come back and tell you, yes, it's positive for cancer or no, and it's positive, it's high risk, intermediate risk, or low risk. If it's high or intermediate risk, the doctor may decide then to do a biopsy, okay? And then if you're picked up with cancer, go on for treatment. Okay, with this kind of test, obviously a lot of patients will end up avoiding the need for biopsy, and there's some certainty of diagnosis. You won't be left in that big group hanging there with a high elevated PSA and with no certainty whether there's cancer or not, right? So this kind of tests probably will have a big role to play as we progress, okay, as we get more data, but probably coming on stream within the next month or two, then, probably we can offer this to patient, all right? Okay. Next, in terms of prevention, okay, so next big question will be prevention, all right? We know that prostate cancer, there are certain risk factors we talk about, age being one, ethnicity, and then family history, okay? So this we consider as non-modifiable risk factors. You can't change your age, you can't reverse your age such that you become younger instead of older. Ethnicity, you're born into the ethnic group, you can't change that. Your family history, you can't change as well. So this is stuck with you, you have to live with it, okay? But there are also modifiable risk factors. So I'll provide you with 7 tips. This happens to be 7 tips that I've written up on recently over the past week, submitted to HiDoc as part of the Father's Day piece that they requested. Okay, I'll run through with you in a little bit more detail some of the things that you can do. Number one, maintain a healthy weight. Okay, we know that obesity does not directly cause prostate cancer, but obesity does increase your chance of developing complications from prostate cancer treatment. And if you're obese, you have higher chance of dying from prostate cancer. Okay. Number two, exercise regularly. Okay, it will help you lose weight and stave off obesity. And of course, in addition, it actually helps promote healthy blood flow. Without this good blood flow, there'll be areas in the body that we starve of nutrients and oxygen, okay, building out toxin leading to cellular damage and cancer. And what we do know, and in terms of research, is that in terms of exercise, vigorous exercise is best for prostate cancer, not a gentle walk. You actually have to, it needs to be vigorous enough for you to be relatively breathless, to only hold 1 or 2 sentences rather than, you know, having a long conversation with the person. All right, aim for about 150 minutes of this vigorous exercise a week. 3, eat more fruits and vegetables. We know that they contain vitamins, minerals, fibers, and all the goodies in terms of anti-cancer phytochemicals such as carotenoids, lycopene, and flavonoids. Cruciferous vegetables like broccoli, cabbage are also associated with reduced risk of developing prostate cancer. Number 4, reduce the intake of saturated fat consumption. Okay, several studies have indicated a positive association between saturated fat intake from meat, especially red meat, and dairy products and prostate cancer. So intake of red meat and dairy appears to also be related to an increased risk of metastatic prostate cancer. When I say prostate cancer, is cancer that has spread. So this is the last stage or late stage prostate cancer. Okay. Stop smoking. We all know that smoking is bad for our health. Okay, it leads to a lot of disease and disability in general. While smoking may not be directly related to development of prostate cancer, we do know that, you know, cancer behave more aggressively if you're a smoker and you actually have higher fertility. All right, prostate cancer who smoke are also more likely to have cancer that spread to the rest of the body and complications. Okay. Number 6, manage stress. High level of stress and anxiety impair the body's immune system and prevent it from fighting off disease, illness. So researchers have found that behavioral stress can accelerate development of prostate cancer and weaken the effectiveness of your drugs that you're taking to fight cancer. So medication may be a good way to relieve your daily pressures of life. Okay, all right. Number 7, and pretty important, men know your risks and get tested. Okay, men with high risk of developing prostate cancer include those I mentioned earlier. If you have 2 or more family members diagnosed with prostate cancer at an early age. Okay, so this man should consider going for screening from the age of 45, and those of average risk can discuss the benefit of screening with their doctors from the age of 50. So in summary, okay, prostate cancer is a common cancer afflicting Singapore men. Okay, early disease has no symptoms. Early diagnosis saves lives, and early disease is curable. Okay, if you detect early, right? So that comes to the end of my talk. If you need to reach out to me, my contact is on the screen. Again, reach out to me on my phone or via my email on the right, or if you want to have an appointment with the clinic, it's on the left. So I'll stop sharing the screen and invite Andrew back to join us.
Hi, Dr. Lee. Thanks for the informative health talk. So now I understand better the function of a prostate and what does it do. And
Okay.
yeah, and what are the screenings I can go for? Yeah, so I think come to the question Q&A. So thanks William for actually I saw a list of questions. Actually, one of the questions he asked, right, also relate to myself. I wanted to really ask. So one of the questions he posed is why do someone cancer? Let me rephrase what he was asking. So does sometimes some of patients, right, or male, right, they are being diagnosed as benign prostate hypertrophy. So does that turns into cancerous or does that become like prostate cancer?
Okay, very good question, Andrew. And thanks, William, for the question. So a very common question. Okay, so the short answer is that prostate enlargement do not cause prostate cancer. Okay, but what happens is that in general, patients when they are actually seeing a doctor for prostate enlargement, they undergo a general check of the prostate as well. So on the regular checks, year on year, month on month, it's not unusual. It's not for the doctor to actually pick up concomitant prostate cancer in the same patient because, the doctor is checking your prostate anyway. And of course, both conditions are pretty common as you get older. So that's probably where the misconception arises.
I see. So it can be pretty scary because it can sound very similar in for layman lah. Like when I have urinary problem, oh no, am I having prostate cancer or doctor says it's enlarged prostate, does it mean that I'm gonna have cancer in the prostate sooner or later? So moving on to another question. Yep. So somebody says, okay, this is quite a common question lah. So someone says doing biopsy can actually spread cancer. So let's say, hearing from you there's a prostate cancer, that sounds very painful. So can can a biopsy spread the cancer if it's, cancerous already?
Okay, so it is true. There are certain types of cancer whereby the actual act of doing a biopsy to diagnose the cancer can result in a spread of cancer because you're breaking through the barrier, the capsule that's holding the cancer in, allowing the cancer to come up. All right. So some cancers do that, but prostate cancer has very low risk for that. So we are, as urologists or doctors treating patients with prostate cancer, we are not too concerned that that is something that will happen. And without a biopsy being done, okay, without a firm diagnosis of prostate cancer, okay, no doctor will offer you very invasive treatment like doing a big surgery to remove the prostate, right? You yourself, being a patient, you also want to have some certainty that there is indeed cancer before you subject yourself to treatment, right? Yeah. So other than biopsy, I don't think we have anything at present that can confirm the diagnosis and being able to prognosticate in terms of without the diagnosis, we also cannot tell how aggressive the cancer is, what type of cancer it is to plan treatment. Yeah.
I see. So, yeah, Dr. Lee, so meaning that, must go for the biopsy, even though, let's say, we go for the PSA test or the urine test. So, yeah, okay.
Okay. So those are tests. Okay. So every test we have in terms of screening or checks have their own accuracy level or sensitivity level. Some are better than the other. Okay. There's always a leeway for you to have a discussion with your doctor in terms of, hey, we are suspecting there's something wrong. Is there any more further tests we can do to stratify, what is the likelihood of it before subjecting myself to an invasive biopsy, right? So there's some room for discussion or negotiation with your doctor. You don't necessarily have to, hey, the PSA is high, straight we go for biopsy. Yeah.
I see. Okay, that's quite assuring to hear. So that's there's another question that's related to PSA, high PSA reading. So yeah, there's this one of the participants that asked if a patient has an enlarged prostate, will he have a high PSA reading if were to do a blood test?
Okay, so so we mentioned any conditions wrong with the prostate will result in more production of protein called PSA. So yes, it is true. If you have a larger prostate, okay, you will likely have slight higher PSA, but typically not to the point whereby it crosses the threshold for suspicion for cancer, right? So anything greater than 4, okay, we have to take it seriously. Most of the urologists or doctors will want to rule out that underlying possibility of cancer, and not just hey, just wave it off and say, hey, this is probably caused by enlarged prostate because you have an enlargement of prostate. Yeah.
Okay. So I think if like a lot of times when we took this blood test and we get to know the results and then we start to Google ourselves the patients, right? So I think it's it's best to talk to your doctors and find out a little bit, some of the underlying symptoms. And I think it's best for the doctor to explain to you like what Dr. Lee has explained to us. So I think next question. Oh, we move on a little bit. Yeah. So there's this question that asks about the prostate cancer at stage 4. If it's in a metastatic stage, how many years can one live? And this is probably my personal question: how can it affect your quality of life if it's in the
Okay. All right.
stage 4?
So prostate cancer is a last stage of disease. If you look at my slide earlier, typically stage 4 cancer, the survival at 5 years is about 38%. If you look at the slide earlier, so that is the range we are looking at. Okay, so when we are managing patients with late stage cancer, okay, it doesn't mean that we don't provide any treatment for the patient. Okay, there's still a lot of very useful and effective treatment available, like hormone therapy, like chemotherapy, okay, which can do a very good job of slowing the growth of the cancer or stopping the growth of the cancer, okay, while they're on treatment. But of course, at some point, some of this treatment may fail because the prostate cancer, okay, over time, they learn to build up a response and mutate and fight against some of these drugs, okay, and it will progress. But as much as possible, once they're diagnosed with that, they start on therapy. The whole idea of therapy is to take away the discomfort from the cancer, okay, shrink the cancer, stop the symptoms so that you can actually have a reasonable quality of life, be pain-free, can do your regular things. We try to extend it as long as possible. Yeah.
I see. I think a lot of times pain is one of our most fear kind of effects of from especially in late stage kind of cancer. So writing on this, there's another one, quite a concerned participant, I would say. So my late father was actually diagnosed with, the participant's late father was diagnosed with prostate cancer at the age of 77. So currently, his eldest brother is actually monitoring his PSA level. So I think his PSA level is slightly on the high side. So Eugene is actually he's concerned that whether, is he a high risk?
If his father is actually diagnosed at the age of 77, that doesn't put him in a category whereby he has a elevated risk compared to a general population. So he can consider himself at not increased risk, okay, and follow the general guidelines and recommendation, and consider doing a prostate check from the age of 50. Yeah.
Okay. And probably perhaps follow the 7 tips that you shared with us, with us earlier on. Yeah.
Yes, that would be helpful. I mean, those tips are general tips, but you realize that they are repeated in a lot of other diseases as well. So healthy lifestyle to prevent one cancer is also the healthy lifestyle that will help in other conditions like blood pressure, heart disease, or even a colorectal cancer, any other cancer as well. Yeah.
So
They cross
hearing from
path quite a
you,
bit.
I see. So hearing from you, the exercises, they must be quite a vigorous one, that you must be breathless. So it kind of, cancel out the 50,000 walk that I have. Probably I need to go for a more intensive kind of exercise. So I think, yeah, next question that was posed by Helium. He asked, what's the best treatment actually for prostate cancer? Like what kind of usually the medicine do they take? How do we know whether treatment is successful, and do we really need to do a PET scan to see whether does it spread after treatment?
So two very broad question, William. So it depends on what stage the cancer we're talking about. So in early stage cancer, whereby we are looking at cure, the usual treatment of consideration will either be surgery to remove the entire prostate and the surrounding lymph nodes, or radiation therapy. Both are very good modality of treatment, okay, to aim to achieve cure of prostate cancer. Okay, when it's a little bit later stage or more advanced stage, up to the point of metastatic, then the treatment is a little bit different. Okay, the backbone of the treatment then is hormone therapy, a regular hormone therapy to suppress the production of testosterone that stimulates the prostate growth. Okay, to keep prostate cancer at bay. In addition to that, there are other therapy that can be added on in terms of combination, chemotherapy or new androgen agents, okay, that can be used to further supplement the treatment. So whether one is better than the other, okay, it varies on your health condition and your specific situation. It's very hard for me to give you advice, what is a better treatment for you without seeing some additional details. Yeah.
Okay. Thanks, Dr. Lee, for answering that question. We actually have quite a fair bit of questions here, so I will just, if I'm unable to finish all the questions, so just bear with us. Okay, so I think a follow-up question from Helium. He said, actually, how many cycles of chemo plans, does usually a patient undergone through? Yeah, for in terms of cancer.
Okay. So in general, the chemotherapy range from 4 to 6 cycles, but the usual state is every 2 to 3 cycles. We will do an assessment. The medical oncologist will do an assessment to see whether you're responding, your cancer is responding, to decide whether to complete the treatment. And even after you complete, whether at some point you need to restart and continue treatment. Yeah. So it varies depending on how you are responding to the treatment. Yeah.
I see. So there's this very interesting question that was posed. Wow, can prostate cancer, lead to a introduction of a urostomy bag? Well, I never heard of that. Urostomy bag. What is
Okay.
urostomy bag in the first place?
Urostomy bag. Okay. All right. Okay. So urostomy bag is a bag that is used to drain urine. So the urine actually flows through, from the kidney to the ureter, stored in the bladder, and comes out through the penis, the urinary tract, through the prostate. In cases of very advanced prostate cancer, okay, whereby the whole urinary outlet is obstructed, okay, for instance, or the cancer is so bad it actually blocks a lot of the urine passage. He may need a surgery to remove the prostate as well as some of the part of bladder, for instance, okay, resulting in the loss of bladder. So there'll be a bag that comes out. But if you're talking about urostomy bag that is coming out through the kidney, that's called a PCN tube. That's different. This happens when the prostate cancer is so advanced, invade into the bladder and the urine is not able to come out, right? Okay, so that causes a back pressure. The bladder fills up, you go back pressure and causes swelling of the kidney, okay, in order to allow the urine to come out and decompress, allow toxins to come out. what sometimes we do is we insert a tube through the skin right into the kidney to bypass, to allow the urine to come out through this back passage rather than coming down the ureter into the bladder.
I see. So I wonder if you mentioned about, you mentioned too about PCN and the urostomy bag. So does urostomy bag, is it a temporary one, or, at times it could be a long-term one for
Okay.
some of us?
So at initial diagnosis, when it's obstructed and we want, if the patient is in, the kidney is all, toxins builds up, there's a lot of water retention. In order to relieve it, then the urostomy bag is inserted to acutely decompress. And then if we start treatment for the prostate, okay, if we start maybe chemotherapy, hormone therapy, with time, if it responds, okay, the prostate swelling may come down to the point whereby urine can flow through the bladder out through the penis again, right? And when that happens, then you can do away with the PCN tube. Yeah.
I see. Okay. So following through, there's quite a bit of questions about, let's see, what's this? Okay, so there are quite a fair bit of questions about what is this serum indices, correct me if I'm wrong, indices together with the PSA tests.
Okay. So those are refinement of our standard PSA test. So the indices we are talking about, we are looking at isoforms of PSA, like free PSA or isomers of different forms of PSA. So those are a little bit more sensitive when taken into together with PSA to give you a better idea how likely that this elevated PSA is due to prostate cancer, okay, and help guide doctor's decision whether to proceed with a biopsy. So this can be a free total PSA level, a ratio, or a test called PHI test, prostate health index test.
I see. I hope that answer your question. Another question is actually I also want to ask. So when and where can we do the urine test, which you mentioned earlier on?
Okay. So it is just in the midst of being launched, probably in about 2 weeks or so, we have a little bit more details. We just attended a launch briefing a couple of weeks ago. Exciting test, but it's not cheap. The price is yet to be confirmed, but I think it's in at least $1,000. Not cheap test. Yeah.
I see. Okay, so I think there's Dr. Lee just answered one of the questions, posed by the participants. Can prostate cancer be receiving radiotherapy treatment? I think you just mentioned that it does. Okay. This is a very interesting question. How much PSA number can kill people? I don't quite understand, William, what you are asking. Dr. Lee, do you understand what?
Okay, so a PSA, if we are diagnosed with prostate cancer, a PSA is a marker we use to give us an idea how advanced the disease is. So we know the normal level is less than 4. Anything higher than 4 is dangerous. Okay, so we have seen PSA that goes up to the thousands. Okay, and that typically means that the volume of prostate cancer, the disease, is actually very high. All right. The PSA itself don't kill you, William. Okay, it's just a number that give us an idea how much cancer volume that is actively secreting protein, this protein within your bloodstream. At any PSA level, there's still options for treatment.
I see. Okay, but I guess if you are seeing a very high number in your PSA, definitely your heart might, you might go into a panic attack. But I think best to seek your doctor, on the result. If I were the person, I would probably get into panic attack as well. So I think there's also still, I think you answer some of the questions, but I think most of the questions here are revolving around treatment. Like, I have prostate cancers and chemo, surgery, and versus RT, radiotherapy. Which one, macam like we can choose like that. So which one do you think might be better suitable for early treatment in terms of probably early prostate cancer?
Uh, okay, so in early stage, whereby the discussion is in terms of aiming for cure, then the options we are looking at, is either radiation or surgery. Like I said earlier, okay, both of them have very comparable cure rates. So either one is feasible. The general discussion then is your risk appetite, your health level, and in terms of side effect profile, both of them are quite variable. Surgery hits you at a time whereby you actually have a surgery. It's a big surgery. Okay, the first month or so, you're going to be very uncomfortable trying to recover. Okay, the main side effects after surgery is two. One is urine leakage, urine incontinence, and erectile dysfunction, erection issues. Okay, that's the main thing that hits you. But as you progress in your recovery, and months go by, okay, you get better and better. All right, and a lot of these side effects actually improves. Okay, radiation works a little bit differently. Radiation is spread out in the sense that throughout the therapy, you actually put up with it a lot better. Okay, but the side effect comes on months to years later. So the side effect is whereby imagine your prostate is being treated, is being burned. Okay, so there's a lot bit of collateral damage. The radiation effect hits the surrounding organs. The bladder gets a bit of radiation. The rectum that sits behind the prostate gets a bit of radiation. So those manifest over time, months to years later, whereby the bladder gets a bit of scarring, a bit of fibrosis, so you can't hold the urine as well. It doesn't hold so much urine. You run to the toilet quite frequently, very urgent urination, a bit of blood in the urine. The rectum, you get a bit of radiation proctitis again. The tissue, the nature of tissue is not so good, so you get a bit of diarrhea, a bit of blood in the stool. And as time goes by, year on year, you find that those symptoms manifest more and more often and more severe. Okay, so whether you want to take the hit early on, or you want to put up with it, take a risk and have it subject to the risk later on in life. So in general, the discussion with the patient is that if at the time of deciding treatment, if you expect your lifespan to be at least 10 years, okay, maybe you want to consider surgery versus rather than radiation. Right? Yeah.
Okay. So I hope Dr. Lee has answered your question. So actually, Dr. Lee, when you are talking about surgery and radio, right? This question came about, in my mind, how, let's say, maybe, a huge part of them is middle age 45 and above. Let's say this gentleman wants to start a family. How, after after surgery, or maybe I'll just choose surgery because you mentioned about RT, right? As beyond years of, that will affect me slowly.
Okay, so a little bit unfortunate if you are being diagnosed with prostate cancer at 45, very young age of prostate cancer. Having had surgery for prostate cancer, okay, it'll be difficult for you to conceive naturally because through the act of removing the prostate, the tubes, the ejaculatory tubes are cut as well. So at the end of the surgery, okay, you may maintain erection, but you will not have any ejaculation. So no ejaculate will come out from the testis, but you are still able to father a child, but that needs to be done through some assisted reproductive techniques. So like IVF. So the doctor will need to go to the testicle, the factory where the sperms are being made, retrieve some of the sperm, okay? Then the lady partner will need to undergo IVF by the sperm, is manually injected into the egg and then, go in the womb. Yeah.
I see. So would you recommend, like, nowadays people don't get married so early, and when they want to find out children, would you recommend like they freeze or extract the sperm, before anything, and then they can do
Yeah.
IVF
So
later?
prophylactic sperm banking is not approved in Singapore currently. Unless you're diagnosed with cancer, okay, prior to treatment, okay, you want to bank some sperm, yes, that's possible. But not in anticipation or prevention or in just as a safety. Those are not approved. Yeah.
I see. Okay. So I hope I help some of you paise to ask. I ask Dr. Lee on your behalf. Okay. So there's another question here. Hi, Dr. Lee. Okay. Freddy asked about, is urine form element test related to prostate cancer?
Urine form element. Okay. So we call it UFIN for short. So that is not a test we use to diagnose prostate cancer. It is a very common screening urine test that is seen in a lot of health screening panel. The main thing it is useful in testing for is any evidence of urinary tract infection, number one. It is also good as a test for any presence of protein inside the urine as early marker of kidney disease. Okay. Any evidence of elevated blood level or crystal level within the urine that may suggest that you actually have kidney stone disease, for instance. Yeah.
Okay.
Not for prostate cancer.
Okay. So thanks, Dr. Lee. So Freddy, hope Dr. Lee have answered your question. So I think today we learned quite a fair bit about prostate, the functions, how do we do screening, various type of diagnostic screening tools, how does treatment come about, what will be the probable complications or side effects of some of the treatments. I think we learned so much about prostate cancer and prostate itself today. So let's thank Dr. Lee today again and give him a round of applause for teaching us and sharing with us, prostate cancer.
Okay, thank you very much. It's a pleasure for me to be here to share as well as answer some of the questions. Thank you, Andrew.
Thanks, Dr. Lee. Yeah. Hey, yeah, sorry, my mic got problem. So I was talking about the Facebook quiz that we posted some time ago. Yeah, so before we announce the winners of today, we'd like to have a special thanks to Lapel Singapore Private Limited for sponsoring the winner prizes, And if I may announce the winners of the quiz, the 5 winners of the quiz are Stephen Han, Oscar Chi, Fei Ying, Vicky, Kay Ong, and Lisa Chan. Congrats to the 5 of you. So how will you receive the prizes? My colleagues will connect with you through a Facebook platform. So stay tuned if you didn't manage to receive reach out from us. Do reach out to us through the Facebook avenue as well. Okay, so that wraps up the winners for the quiz. So along the way, we have done quite a fair bit of health talks, and I think some of us, thank you for following us all the health talk throughout the years, especially this recent month when COVID has hit us, we bring the health talk online. So there's this QR code. Let's say if there's some topics that it's very close to your heart and you want to know through the health talk, do reach out to us through this QR code. And maybe you think, hey, maybe we can do better in our health talk. Andrew, maybe you can talk about something else, you can introduce something else, do let us know through the QR code as well. So I think my colleague will send through a hyperlink in the chat as well. So if you can't scan the QR code, do scan through, do click the hyperlink and we will appreciate a lot about your feedback, how we can improve our health talk following through. And let me just introduce to you the next health talk that is coming in July. So it is in Mandarin. And something that I will be very interested as well, the health talk. It is about how to eat healthily when we tapao. So nowadays, right, all of us tapao, right? Especially, all of us are back to office. We hardly have time maybe to cook. And probably most of us are eating out within lunch or dinner. And yeah, so it can be healthy. Even tapao can be healthy. And the speaker is nonetheless our in-house dietitian Hui Xing. So she will share with you how to eat healthily during taking out. And it's on the 16th of July, same time, same place. But it's in Chinese. So I look forward for all of you to join us in this very interesting health talk. Definitely I will want to join. So before I end off, please remember to like and share in the following media platforms that we have in 365 CPS as well as Farrer Park Hospitals. So you can reach out to all these platforms. And thank you everybody for spending this time with us. I'm sorry if we didn't manage to answer some of the questions here on the platform. So we will see you again in July. Bye. Thanks.